Welcome back to The Ways We Work. I'm Joel Thomas, Director of Education for America Works, and I'm with Dr. Lee Bowes, our CEO. And today we're going to do a bit of a retrospective. Not that far back, only the last 5 years or so, going back, well, almost 6 now, going back to an experience that all of us globally encountered, the COVID-19 pandemic. We're going to discuss your leadership and our leadership as a company in the midst of the uncertainty in those early days, and how that moment and those moments that followed reshaped workforce development forever.
Great.
Do you remember?
Oh, yes.
Where you were?
I remember. Who could forget? The first thing I was down in Key West, and they decided to evacuate all of Key West. Everyone had to leave. There was no way to get out of there with an airplane because they were all tied up. So I had to hire a plane and fly back.
Oh, wow.
To New York. And it was a surreal experience, which my husband, Peter Cove, said, let's fly private all the time. And I'm saying, do you know what this goddamn cost us? It was like ridiculous. But the dog loved it. And the pilots were very friendly, but it was scary because nobody really knew what was going to happen. We knew something terrible was happening, but we didn't know how long it would last. We didn't know what it was all about. We didn't know it came from China, it came from a lab, it came from these live animals that they sold at various stores. And it was a very, very uncertain time. So that was the beginning of the pandemic. And I believe that was in 2020. 2020.
Yeah, in March. But I remember being at headquarters and hearing you talk about the headlines that were starting to emerge. There's this virus. And I remember you being concerned about it even from as early as January. And
right.
Really having it, even before you went down to Key West.
Yes.
For the winter. And I have always been impressed by your responsiveness and your decisiveness during those first few months. Can you take us back to like the first moment when you realized that it wasn't going to be a short disruption, that it was going to be this real life-altering event?
It grew slowly. I mean, it didn't all of a sudden occur to any of us that it was going to last for years and that we were going to be isolated. That was the only way to control it. I think there were so many conflicting positions coming out. The White House was trying to say it's nothing, everyone go about your business, keep business going. We can't shut the country down. And then there were the doctors who were coming on saying, this is highly contagious. We really don't know. The only thing they had that they were looking at was the bird flu. The bird flus had both 2 times been somewhat averted, so it never became quite the pandemic. But this virus was a variation of that. And they honestly didn't know if it was created in a lab and it was created by the Chinese to give worldwide panic, or it was just a naturally occurring virus that had emerged from China. We knew it started in China. They wouldn't even allow, nor did we send people from the World Health Organization into China to really do the research, keeping it all very hush-hush and secret. And that was, I think, very confusing. But our point at America Works for our staff and for, in particular, the clients who were really in a panic was we had to present calm. We had to present that we were going to continue to provide our services, however we had to do that, and that we would soldier on and basically continue to be working. So I remember the sense that, hell, I'm going to have to get up and talk to people like Joel and others and say, we know this is going to be a long, drawn-out thing, and we're not sure how long, we're not sure but we are going to survive this, and we're going to flourish in this. And that's precisely what we did. But that was, the strength of saying, we have to. We had no choice, really. We had no choice.
Well, there are always choices, but we're glad that you made the choice to keep your doors open.
Well, we had to. What was I going to do? Cut off 300 people's livelihoods, our staff? I just, and the pleading that we did with the people who gave us money and funded us and was that, this, you can't just stop and start this again.
Right.
And we have ways. So I think the first thing we did, we wrote a policy, a detailed policy about how America Works was going to keep its doors open, if not the doors literally, our voices open, our people. We were going to be in contact with the clients that we served. We were going to continue to provide them services. We were going to do everything we needed to do. And we presented this to first the city of New York, who were like, can we borrow this? And I said, what do you mean? Well, could we use this? I said, please, go ahead. And over the next few weeks, every state we were in, every local county we were in, took our proposed way in which we were dealing with it and adopted it and got their political leadership and other people in the community to agree with it. And ultimately, we kind of led the way on how to do remote work, but continue the contact that we had with the clients and continue doing the services. And I'm not going to take sole credit for it. It was a whole team effort that had to do with everybody who worked with us.
Entire company.
Yes. And
overnight.
Yeah.
Switching to remote work.
And that was so anathema to us because I was, there are so many people who do our work, who do telemarketing and, call people on the phone, and they do other things that are just talking to people on computers. And we never did that. And I was always very proud that our staff were face to face with the people we were helping. And that was so important to me. And I couldn't conceptualize without that interpersonal. How do we touch people? How do we move people from one place to another? And can we have that same effect? So there were a lot of things, Marcia Nettis implemented these remote job fairs where she would bring in business leaders who still their companies needed people. Right. And they would talk about interviewing remotely and what that looked like. And we had clients come into those meetings, and we had people in the government down in Washington and Maryland. And, she continues those to this day. It was so effective. Yeah. So there were learnings that we had that really were important for us. But I struggled with it. I think a lot of people did. The isolation and the fact that it went on year after year.
Right.
Being at home and trying to, do Zoom calls with people you were friends with that you used to see every day. And I remember talking to people who were out in California. They had moved shortly before it, friends of ours. Mm-hmm. And it was just so hard to well, what are you doing? Nothing. What are you doing? Nothing. So, it was kind of like, okay. And people would have happy hours on Zoom calls and things like that. But it took a while to adjust to it. It really did.
Well, I want to say that I was particularly grateful to be able to continue working because there were a lot of people in my life who were not able to.
No, I know.
So for me, bread and butter is always the first primary need. But you didn't stop there. I mean, you made sure that over time with the isolation that you brought on people to help engage us. I remember that yoga class we had for
I know.
It was interesting doing yoga on Zoom.
That was very funny, though.
And some other activities that really considered the social aspect, both for staff and for clients.
Yeah.
So
what I realized was it was so popular when we first did it. There were the screen was so crowded with people taking the class. And I thought, oh my God, if this catches on, we're going to have to get more classes. But then after the first one, the second one, the third one, and the numbers started to dwindle, I said, well, the pandemic's not so different than everything else. Right. Because I remember someone who owned a gym telling me, well, you sell all these memberships, but your key is not all of them are going to show up. And slowly they all stopped going. And I was like, wow, what a business that must be. I wish I had invested in a gym. But it was good because there were some steady people who went and did that. And at first it was a real boost.
Right.
Because people could do that at home.
Yes. And all of the additional resources to help with different personal and social crises that naturally accompanied isolation and other family issues were available to people. But outside of that, all of the really resilience that went into the work, there were challenges that you had to face in your decision making. What were some of the hardest decisions you had to make in those pandemic years?
Well, as the years went on, I had some top management people, not together, but independently, came up with the brilliant idea that if we're working remotely, why not go to Bali and have a vacation? And I was like, wait a minute. So the IT guys came in and said, I think they're not in San Francisco. I think they're overseas, like in a exotic island. And I'm like, what do you mean? Well, we're trying to follow the call-ins that you do, management meetings, and he's not in the United States. And I'd be like, okay. And I was like, what's going on? And so I finally talked to this person. Well, I thought it was my right to do whatever I wanted. I could call in and have a meeting with you. But, if I wanted to I said, well, you didn't sign up for a vacation. You said you were working full time. You were remote working. I was like, how dare you question me? It's like, sorry, but what I have noticed that you're not doing anything related to work except my meetings with you. And I find out that you're in an island, a tropical island in somewhere across the globe. Well, yeah. I said, well, let me just get back to you. And then I was like, I can't have somebody doing this. This is a terrible example. So I had to let this person go. And they were so shocked that they were indignant. But I realized that I had to let people know, we still have a vacation policy. You can still request vacation and go on vacation. But when you are here, you are at your home base, you are on your computer, you're doing work, and it's not time for you to just take off. And that was a struggle because some of the staff didn't realize that they were still really required to do work. We had to develop things to really monitor our staff so that we knew they were working. I had one very enterprising young woman who was married to a technology person. One of the things we did was our tech people would look at computer usage. So they would see that somebody was on the computer, they were using their mouse, they were entering things. And she had designed, or he had designed, a mouse that would look like she was working all day. And she wasn't working. She just had the mouse running around her desktop and creating all this work. And I kept using her as an example. She's so productive. I mean, what is wrong with the rest of you? And then somebody came in from our tech department and said, I think there's something suspicious because the mouse is doing the same exact movements every hour. I said, what do you mean? So I said, what the heck? So we realized we had to get more sophisticated about that. I mean, we had to really start to look at things like outbound phone calls, data entry for case notes was always a big, big deal with our agencies because we're working with people who need a variety of services, and we have to enter in for the government agencies, the counseling services, the medical treatments, the if there's any emergency calls, which we had quite a few of, where people would sound on the phone like they were depressed or even suicidal. They were wondering, is it all worth it? And those kinds of questions. And we got very close to the police departments in various different cities throughout the country where they would agree to go over and do wellness checks. And it was a big issue for the police as well as for us, where, especially with low-income people, there were a lot of situations of, personal turmoil in the homes. There was violence. There was people being physical with other people. So we were able to work that out. We never had to deal with that at that level before.
Right.
So we really knew that this was a strain on everybody, in particular, our people who were at home.
So you have all of these enhanced client needs.
Yep.
We still have to meet all of our obligations based on federal requirements.
Right.
And the demands of funders in different states, and you have this real renegotiation of work and the boundaries of work happening in society, where the lines are blurred, everyone's working from home who can still work, and people are getting messages about the things that they should be able to do. And there are real demands and needs for flexibility because people have to manage their kids working, school and remote learning while working at home. So you want to provide that flexibility. We still have to meet our mandates and our obligations, and people and society, the voices in society, keep moving the needle on what work means and what it should be and allow. How do you manage all of that as a CEO?
As
all
I
the voices.
Said,
everybody has an opinion, I'm sure.
I mean, you would understand because as head of education, you developed a couple of hundred different programs people could access remotely.
Right.
And that forced something within your department in terms of learning remotely for our clients that we still use even today. So I think it was a real effort of coming together. One of the things we tried to do a lot of, which was deliver food and get more cash to people quickly. I think that was helpful. We had greengrocers and farmers who were trying to get some of their products out to people who were giving us donations and we could distribute them. Anything we could do like that would keep people engaged and deal with their immediate needs was helpful. But one of, I think, the best things we did was get tablets and laptops to the people who are our clients, which in the past, we had always done this, teaching them in the classroom how to use computers and how to use cell phones and how to use remote access to learning. And it never really took off the way it did at the pandemic because people were at home and they needed this to teach their children and to get their children's homework. They needed it to engage with us. By engaging with us, they continued to get other services from the government agencies. So it was a win-win situation where I think I've mentioned this before, that our clients really upped their engagement and their learning of how to use remote devices. And that was a big win because that learning to do it without having it in your home, not having access to Wi-Fi, which now everybody had. I mean, the one thing the politicians did was they really made sure that that access, which had been, I don't know, they called it the desert for certain communities.
Wi-Fi deserts.
Yes. Yeah. And that, they did address because they had to. How are we going to get? I mean, there were so many different things. And I think that was very helpful. There was also ongoing conflicting information about vaccines and getting vaccines and how to get vaccines and whether you should get vaccines, not get vaccines. I mean, nothing like the discussion that goes on now. I think everyone who could was getting vaccines. But I remember in New York, standing outside in the cold, and they had just come out, it must have been a year after the pandemic started, with vaccines. But I literally had to stand outside for 4 hours waiting to get the first vaccine. And when the young man gave me the first vaccine and he was looking around, he like punched me with the needle and he was like, I've got to find a muscle. I'm like, what? He said, well, I just got taught to do this like 2 days ago. And I'm like, oh. And he finally found a muscle and he squirted it in. My arm was sore for like 2 weeks. But we were all very hopeful about getting the vaccine. We thought the vaccines were going to at least allow us to go back to normal.
Right.
And of course, it didn't happen right away, but it did ultimately happen. And so there was a lot of learning that went on. There's a lot we still don't understand. Could this happen again? Probably. And, when the bird flu came out, I don't think you would remember it because you're too young, but there was a whole panic that ensued that it was going to be a major epidemic. And then it never did. it never came to be fruition. And so I think a lot of people thought, oh, this is just going to go away as well.
Right.
But it didn't. I think a lot of countries really handled it differently than we did. So I know that Europe, like my brother lives in Italy, and he was completely isolated. But my friends in London and England, the schools were still open and they still went about their business. And, they're the first to tell you that they were smarter about how to handle it than we were. But, hindsight is interesting. I would say that the medical people who were seeing the first of it, and in New York here, we saw so many people die in the initial months, and especially older people and people who were vulnerable, that they were definite to basically have people isolate and mask everywhere they went. And they didn't know any other way to control it. And I think, I don't know how we'll handle it the next time. They got the vaccines out fairly quickly, but it was still quite a while after the start. And if you remember the sound in New York City of people banging on drums, or it was banging on with spoons on pots.
Yeah,
and
to congratulate or celebrate the
healthcare workers who were basically giving up their life at the hospitals. It was just unbelievable.
Yeah, those were some really intense years and months and weeks. And at the same time, a lot of clients that we had just gotten jobs, a lot of people lost jobs and couldn't work, but then a lot of people had to work. And that, for the first time in my life, created this distinction. I mean, I had done essential work. We never called it that before.
Right.
I had done essential work early in my career, but the difference had never occurred to me in such a stark way.
Right.
Like, there is a whole segment of our society that does work that cannot be stopped, that cannot be made remote.
Yep.
And our entire society runs on their labor and depends on their labor.
All the people who are delivering food, who are working in the back of kitchens. And if you think about the amount of time people were taking advantage of going out and picking up food or having it delivered to them, I mean, that was just, I guess, one of the ways people were surviving. But those people, that work that was done was work all over the country. And it was a lot of, as it is now, immigrants who do that work, and people who really don't have other alternatives. A lot of the people we deal with had the alternative of government support. And, that continued to help them. And they had to teach their children at home. So, I mean, it was interesting because we had Zoom calls initially before we did Teams meetings.
Right.
And the Zoom calls would have our staff lying in bed, in pajamas during the meeting. It was like, hello, are you with this meeting or are you just having a nap? I mean, so it was interesting. It was kind of funny, some of the things that happened, but
there were a few renegotiations
like,
with the idea of professionalism.
Well, I don't know if they didn't have an idea that they could be seen or if they just thought this was normal. I don't know.
Well, and to be fair, there were some, we had to shift and make our homes our workspaces so quickly. And some people have lived, especially here in New York, lived with several roommates, and they didn't have the ability to make such a quick turnaround of their space into a nice office space.
Right.
I had a nice little setup in my basement, in front of a piece of art that is actually the first thing I ever bought with my first paycheck at my first job at Domino's.
Wow.
And it was like, it became such a moment for me in the beginning, before we knew about like backgrounds to your Zoom screen and all that, to have this behind me to remind me of the importance of work and the fruits of my labor, to inspire me throughout the pandemic. But, I hope everybody found some tether to hold on to. What was yours? My
tether? I had always started working out in gyms, and I went to the gym religiously every day, whether it was in New York City or in my house in Connecticut. And I just knew I couldn't do that. So I started going outside, and I started running outside and walking outside. And, even in the coldest days, although 5 degrees, no, in New York City, but that's what the temperature is now. I found that was a great way to start my day. And after the pandemic, still have continued to work out outside. Make sure I go out for a rigorous walk or a run every day outside, because I find that the sunshine and the fresh air, it still gives you something extra that being in a gym just didn't give me. So that was my lifeline. It was what kept me going.
Yeah, I'm embarrassed to say that I have not been to the gym since March of 2020. I
Well,
think I
maybe
should
you
get back.
go outside.
I did walk, and I do walk a lot. I
have noticed that.
But like my body and my health has changed over the years, the job market has changed too as a result of COVID.
It has.
What have you seen emerge, and what have you seen disappear?
Well, the biggest thing, of course, is working remotely. I mean, when we started to go back to work, this various government agencies said everybody has to go back to work full time. So we're in, 8 different states and different jurisdictions, whether it's counties, cities, state government. And that was kind of like get back full time. However, it quickly became clear that the unions, especially the public employee unions, whether it's in Washington or at various local government levels, were refusing to do that. They liked the idea that they had some time to work remotely. So the government agencies had to back off because they couldn't require contractors to do something that their own employees wouldn't do. And so the idea of a mix of at-home and remote work became the norm. And that, has become a norm for us as well. And I've heard and read enough about this to know that people like me, CEOs, understand that people are not as productive at home as they are when they're in the office. I mean, we've done our own internal studies. We've looked at inbound and outbound work-related phone calls versus personal time or downtime. And definitely the people who are working in the office have higher levels of productivity. However, people don't want to be full-time in the office. And I mean, some people do, but very, very few. And that's been the hardest thing for us to adjust to those requirements. I mean, we still have locations where people are full-time at work, but in general, it's a mixture. And, I have a lot of people who want to come work for us, but they want to only work remotely, which would have been unheard of before. I mean, one of the things that's struck me is the rise in people taking what's called Family Leave and Medical Act. People are claiming, they go to a doctor that they need to be working at home or they can't work for a period of time, so they go on something called FMLA. And that allows them to basically take time where they're not in the office working so that they can handle whatever their personal issues are, medical or mental health, whatever they're working on. And that caregiving for others is, it's interesting. FMLA covers caring for others. And then we have all these state programs, some of which allow it and some of which don't. And, they give you like state of New York has a state plan. New Jersey has a state plan. These plans will give you something like, $45,000 annualized a year. But most of the people taking this off get more than that. And they would prefer to get FMLA and take 2 or 3 weeks off every year for some kind of a medical condition and not get paid than they would in working. And that has been a whole rise in something that we never anticipated. And it's caused some management issues. Well, it causes it for you because you have people, who you can't rely on 100%, who are trainers, and suddenly you have to backfill with other staff or you have to jump in and do the work. And that's magnified throughout the company. I don't know the relationship between the two. I don't know why one rose during the pandemic, after the pandemic, but it's become much more of a thing that people are doing. And I'd say 20%, maybe more, of our workforce is like that. And so that's been not a good influence of our pandemic on what's going on. I think one of the things is the long COVID, which I've read a lot about and I hear about, and I see it in some of these letters from the doctors. People who got multiple cases of COVID or had something other going on in their body, they may have not even realized it, heart conditions and all, have what they're calling long COVID. So we have more of those cases. And that's another reason that people are, seek this kind of remedy. But all in all, the adjustment has been a positive thing. And as I said, some of the things we learned to do, we put in practice now all the time. We can have somebody who's out on medical leave work remotely, and they don't have to take it off and to fully not be able to do their job. And that means that they can continue to get paid and be productive and contact with their clients and do the services they need, but they just can't be in the office. So in that sense, it's been positive. And I think you and I have talked about the fact that our clients really got used to using these devices, computers, and that meant that they learned much more than they learned sitting in a classroom with someone teaching them, here's how you use a computer, and they actually had to apply it every day. And that made a big difference. So when we run remote work or we do any of the trainings that you offer, there are people who can take advantage of it anywhere in the country, and they all have access to it, which means you don't have to be present. Your trainers don't have to be present, but you've videoed and audio taped everybody. So all these are in our, what you call it? The
catalog.
Yeah. You have a whole series and that's been a phenomenal resource for the clients, for the people in the field. So there have been a lot of positives.
There have. And while you're discussing a lot of the benefits of remote work that job seekers now have and employees now have, the ability to navigate around health issues and caregiving while still maintaining employment and all of that, I recognize that is a benefit that only one segment of the society who are eligible for remote jobs and can access them has. And I'm wondering what's your take on how we have approached preparing people who have mostly done essential work,
right,
who now want these kinds of jobs that some people label as good jobs, right? Yeah. Stable pay, a competitive wage, benefits, giving you access to things like FMLA if you need it, and other kinds of supports and guarantees. How have you seen us move someone from essential work to remote or other kinds of work arrangements that everybody seems to want now, but not everybody's eligible for?
It's still complicated because I think, the biggest challenge we have is with our Ticket to Work program, where a lot of these are individuals who really can't travel to and from work, and they would like to be able to work in the home. But the most common job, which, I'm sure I get all these people you call if you're going to go traveling and you're using an American Express, you go to Target and you have to return something, you end up talking to people. And I always say, where are you located? And they're like located in
India,
in
Brazil,
right? Israel, India, but they're also in the Rocky Mountains. They're in different states. They're in rural areas, and they have to have full access to computer, to Wi-Fi. They have to be pretty skilled at this, and there is a pretty big bar to get trained enough and to have the equipment that's expensive enough to handle these jobs. And that's probably been a biggest barrier because we have a lot of people who want to do customer service remotely. They say, I'd love to do that. Yeah. But then when you see what goes into it, how do you make a return? How do you know that the thing is being packaged correctly? How do you know to tell them that when they were supposed to receive something, they didn't receive it? Just as complicated computer work that many of our people who do what you call essential work don't have those, they haven't raised to that level of skill yet. Right. And so that's been a problem. I mean, there was a a belief that if we could just teach everyone coding, that they were going to have permanent jobs as coders and that they could be paid much better. And so there was a lot of effort to do coding training. And yet it turned out that if you couldn't move from learning the initial coding to the new coding and the newer computer basic languages that you were going to have to learn, you could not keep that job. So where it sounded like a great opportunity, it, like many things in the computer world, you had to continually learn, teach yourself and learn things.
Right.
And that was a skill set that a lot of our people don't have. They could learn the routine, but they couldn't learn how to go from the routine to the next stage.
Right.
So it's complicated still. And let's face it, I mean, one of the primary jobs we have is caregiving, whether it's caregiving for the elderly, caregiving for young children. That's, so far robots haven't taken that over.
Right.
I think it did in Japan or something, but I don't know if that's ever going to be as satisfying as having human contact with another person and having a caregiver. So those jobs are still growing. They pay well. The kind of entry-level stage for those jobs is fairly low. As you go up and you're talking about getting nurses aid training and getting a certificate and then getting an LPN, and obviously the skills go up, but there is a career ladder there. So it gives people hope. We've also been very successful as, I guess, pharmaceuticals have gone through the roof. Certainly the ads on TV have. Mm-hmm. But, we've started putting people, rather than in direct work at the cash registers, Pharm tech jobs. So we train the people to do pharmacy technician jobs, which is an entry level to get to becoming a pharmacist. And there are steps in between becoming a pharm tech and becoming a pharmacist that allow you to learn on the job and continue to upgrade your skills. And as the growth of pharmaceuticals have just gone exponential, those jobs have expanded. So we see places where the expansion has provided opportunities.
Yeah. I think we're at a really interesting place now. I was just in our Bronx office and I was just stepped aside for a second, the few moments I get because the client traffic is nonstop there. Just stopped for a second and just admired the fact that we're in this place now where we are engaging 300 clients virtually online. And the same trainer is teaching, while teaching them hybrid, is teaching people right in front of her, a room of maybe 50 people as well. And we can serve so many more people. And the need just keeps growing here in New York. And we've reached a place where all of that has been integrated. It's seamless. Whereas in March of 2020, we had no idea what we were doing, but we just did it. And so I'm really proud of that. But the irony is that now with AI emerging, some people are saying that the jobs that are going to be secure are the essential jobs. Plumbing, caregiving.
Right.
So in some ways, we might have to go right back to that.
I know. I'm old enough to know that every technological advancement, there's always been the assumption that it's going to lead to job shortages. Mm-hmm. I grew up in a home where I was not allowed to watch TV. My parents were completely convinced that that was the downfall, that if you didn't start reading, 5 novels a week like I did as a kid, that you were going to never amount to anything. And, it was exhausting because they had so many children. But by the time my youngest brother was born and he started as a painter at 5 years old, he had the TV on 24 hours a day, and he still does. He's in his 60s and he lives in Italy and he's a very famous painter. He never painted unless he had the TV on in the background. I have no idea why or how. But I used to say to my parents, do you understand that you thought the TV was going to be the downfall? Mm-hmm. And your most successful child never turns it off? And they'd be like, yeah, well, we thought it would lead to, shortage of jobs and radio would go out, and it's like radio is bigger than ever. It's like the same thing with computer technology, and when that first came on board and people were saying it was going to lead to all kinds of shortages and never predicted the growth. And I think AI, I know somebody came to me at the company and said, the staff all want AI, so can we pay for it? And I was like, well, first of all, there's a free version, so they can use that. Second of all, from what I understand, and I watch what goes on, they're mostly asking, should I go out with this boy again? I just had a date, and I don't know if, he said these things. And I said, so there's so much personal stuff being asked of AI. Tell them to buy their own AI, because I really don't want to have to monitor their use of AI, because it's apparently used to the point where people have relationships with their AI advisor who starts saying things like, good work, keep it up. And they're like, that's the most affirmation I've ever gotten from anyone. And it's, thank you. I feel good too. Who are these people? Anyway, it's used incredibly for important things, and it's used for a lot of life decisions. Should I look at nursing homes? This is what's going on with my parent. I mean, there's just so many uses of it. And I don't see, honestly, that that's going to take away from any job. I just see it expanding and growing and creating all kinds of new opportunities. So I'm less scared of that, because I've just seen so many things that people were scared of that have ultimately flourished and created more opportunities for people.
And been integrated into our lives. And, it occurred to me as you were talking about people's relationships to generative AI now, that maybe our experience of the pandemic has shaped a lot of our attachment to some of these new AI tools.
Right.
And if we had to isolate again for whatever reason, another pandemic or whatever else could happen in this world, we now have AI, so that would be a whole other kind of experience. So if another crisis happened tomorrow, and we're not looking for any more crises tomorrow, other than the snowstorm that might be coming in a couple days, what would you do differently as our CEO?
I think that every crisis has provided opportunities. And, we've talked about 9/11, and that was, for us in New York, was extremely intense. And to watch the towers come down and watch people jumping out windows. And America Works was called to go down to the area and help reemploy all the people who had lost their jobs. And it was frightening. And I remember having panic sometimes in the city, just thinking out of the blue something else could happen. But on the other hand, it provided, again, a lot of new opportunities, because tremendous amount of construction projects happened. Many of our people could get entry-level jobs in an industry that paid a lot more. It provided a lot of rethinking of how we arrange security. So we had many jobs, and we still do, in security that were never open to our people before. And those, again, are jobs where people don't have to have a lot of training to do them, and they'd pay well. And there's also been increasing focus on documenting our data and our analysis and putting them in secure locations, which has created other opportunities. So I think I would look at the next crisis as, we're going to handle it. We're going to be strong. We're hopefully going to have the leadership in the government that will handle it well. And, we had that. We have that sometimes, and we don't have that other time. But
multiple layers of government.
Yes, yeah. And, I think about something that happened in my building in New York, where everybody was isolating remotely, and a lot of people had left New York City. And then there was a young man. This was at the beginning. He died of COVID. And all the workers who were in the building, there were like 60 or 70, it's a very large building, were in a panic, because they're Dominicans, they live with their parents, their grandparents. There's a small community, and they wanted to be able to, isolate, to wear masks, to be separated by a certain distance.
Right.
And the man who was managing the building, who had been there for years, and none of us really liked him, took the opportunity to fire him, promote all our workers, give them what they needed, and take someone new in to run the building. And we just organized it like a telephone. This isn't right. Everyone got on the phone. We all did a unanimous vote. We got rid of the guy who told them they couldn't, that they had to not wear masks, they couldn't isolate, they couldn't take time off. And things like that. Look what's happening in Minnesota right now. It's a miracle.
Yeah.
It's horrible, but people rise up.
And they take leadership.
Right.
And they work with the changes that are already happening in the world, and they mold it into something new.
Right.
That will shape the next generation for all of us.
Exactly.
And that's ultimately the bigger work, right?
That is.
And I'm always reminded that despite, or in addition to the paid work, the W-2 work we help people get, that there's so much other labor that they perform in all these areas of their lives.
They do. And, we set up America Works is designed specifically to help minorities. And most of our staff are minority. Most of our clients, almost 100% of our clients, are Black and Hispanic and other groups. Mm-hmm. And I was listening to this Coates, who is a New York Times writer, and he talked about something that I knew, that during slavery and the abolition, 25,000 white people went to the Boston Common and protected Black people from going back south and becoming slaves again. When I look at Minnesota, that's what I see. I see these people rising up and taking a stand, and it's so important.
It is. It is. It's the deeper story of America, the deeper work of America.
Well, and it's ongoing. We have to keep doing it.
We do, and we will. Dr. Bose, thank you so much for your leadership during COVID and in all the years that have followed. And none of us knows what the next crisis will be.
No.
If it will be environmental, social, or just existential.
All of the above.
Or all of the above.
If we're lucky, all of the above.
But we will show up.
Yep.
From Monday through Friday.
Isn't that an important lesson in all of this?
Yeah. Showing up.
It's just get up and show up.
Right.
That used to be like the fundamental thing we started our lessons with our clients. It's like, you're going to feel better. Just get out of bed, get dressed, get out.
Right.
And that was so simple. And it makes a difference.
It makes a difference. My grandmother would also say, make your bed, but I don't know if I've inherited that gene. I heard Hillary Clinton say that as well, too. She says, when she did her master class, she said, I always make my bed because I'm not going back into it.
Really?
I don't make my bed.
Oh. Despite your grandmother.
Despite my
and Hillary.
And Hillary.
That's funny.
But in some ways, I've already made my bed. My choices are made. This is my life path.
Yeah. Well, that's a good
And
one.
I thank you for yours.
Thank you.
May we have long life.
I think we already have.
Yes. All right. This has been episode 3 of The Ways We Work. See you next time.